Good afternoon, everyone. Is this just working? I can't hear it. Okay. Good afternoon, everyone. Just wanted to thank you for coming, and for those that will be online. This is a presentation that we had been blessed to be able to give here at Murray State University. And we wanted to reach out and kind of give you some information about the monkeypox outbreak. And so we're able to do that. And so what I wanted to do first is kind of introduce. We'll have a couple people up here today, and one of them will be two of our nurses, Joe Crawford and Angela Thomas. You'll see them in a few minutes. Just kind of go over some of the slides that we'll have today. But mine's more of a welcome. I am the public health director at the Calloway County Health Department. And kind of some of the things that we do for the community, and we base them on like three different words. One of them is prevent, protect, and promote. And within this, one of our goal is, especially for our area, which is Callaway County, and the community, which is Murray, we want to make sure that we prevent illnesses and disease, promote a healthy lifestyle, and protect our community by ensuring a safe environment. And so giving this information out to everyone allows us to be able to hopefully serve the community the best we can. And so due to the monkeypox outbreak, as well as a limited supply of vaccine, which we'll go over in a little bit, we wanted to make sure that we offered this I guess we won't call it a course, but this meeting here to kind of go over those things and kind of some of the things that we're looking at in public health. So a couple of things I wanted to go over with you is some general, and then I'll pass that off to our nurses. But the monkeypox outbreak, as you can see here, as of September 1st, there has been over 52,000 reported cases worldwide. And also there's been almost 20,000, but 19,465 cases in the U.S. and 31 in the state of Kentucky. Current evidence indicates that the virus is spreading mostly through personal and often skin-to-skin contact with someone who has monkeypox. And at this time, most infections have occurred in men who have been reported having sex with men, and some have been identified at sexual health clinics. And there are 11 cases right now in the U.S. diagnosed that are children. And you can see here, this is kind of a chart. And within this chart, you're going to see where Kentucky lies in the amount of cases. California being the top in cases at 3,629. You can kind of see that at the top. And then, of course, Kentucky, and a lot in red there, is 31. And so those are the top 10, as you can see in this chart here, of those in the United States and the reported cases. And this is a worldwide chart. You can find this also on CDC. But as you can see here, these dots, some of them larger than others, these circles, kind of give you an idea of the amount of cases in the worldwide. And you can see that the United States has the largest amount of cases at 19,464. The next closest is Spain at 6,500. So you can kind of see the difference there in the amount of cases in the United States compared to worldwide. And just as a note, if you see the orange circles, those are cases. If there's a blue circle, that's kind of where everything, this is more of the endemic side of, this is where these kind of originated from. So that's why you're going to see those blue circles. Now I'm going to hand this over to Angela Thomas, and she's going to kind of go over some other slides.
All right, so we're going to talk about monkeypox in the state of Kentucky. This is a chart that they have. The link is up there. They update this every Thursday, so you can see the updated cases. So this was as of last Thursday, which was the 1st, when we had 31 cases. 18 of those were in Jefferson, and that's the Louisville area. Callaway County is not on this map because we don't have any cases here. The closest one we've seen was in McCracken. Below that, you can see the cases by age range. Kentucky's had no person 17 or under diagnosed with monkeypox. Our ages range from 18 to 64 is where we saw all of our cases. Up at the top right over there, you can see it broke down by race, which it's almost equally split between black and African American and white. And on the bottom, is the cases with by gender identity. We've had 1 female in the state of Kentucky and 30 males, which is what we've seen in the U.S. It's been mostly the male population that's been affected. Monkeypox is a rare disease. It's caused by an infection with a monkeypox virus, basically the same class of virus as smallpox. The symptoms are similar to that of smallpox, but they're usually milder. It's rarely fatal. Most infections last 2 to 4 weeks and resolve without any specific treatment. Monkeypox is a virus. It's spread between people, skin-to-skin contact with somebody infected with monkeypox, or if you come in contact with clothing or items of someone who has monkeypox. So direct contact with rash or scabs of the person's skin and body fluids, contact with objects, fabrics, clothing, bedding, towels, and then surfaces that have been used by someone who's infected with monkeypox. Also contact with respiratory secretions during prolonged face-to-face contact. Monkeypox can spread during intimate contact, including oral, anal, and vaginal sex, hugging, massaging, kissing, or talking closely, and then once again touching the fabric, surfaces, and objects that were used by someone with monkeypox. This is like a 1-page thing that they have on the Kentucky State website with signs and symptoms. So people with monkeypox, they get a rash. It can be located on the genitals, the anus. It can be in other areas, hands, feet, chest, face. The sores can look like pimples, blisters. Some report that they're painful. Some report that they itch. They typically go through several stages. So the scabs will fall off, and then the skin will heal over. The sores can also be inside the body, in your mouth, in your vagina, or in your anus. People with monkeypox may also have other symptoms because it is a virus. It can show systemic symptoms like fever, chills, swollen lymph nodes, exhaustion, muscle and backache, headache, and respiratory issues. Monkeypox can be spread from the time the symptoms start until all the sores have healed and a fresh layer of skin has formed, which can be 2 to 4 weeks. Here are some images of monkeypox. So on the chest, wrist, fingers, back, they look like pimples. And I said they'll go through several stages. They'll scab, then that'll fall off, and then skin will be over. Testing. The CDC has started to onboard some commercial laboratories to help with the diagnosis of monkeypox. So LabCorp, the Mayo Clinic, and Quest Diagnostics currently have started testing. So it's a swab. It's a dry swab. We swab a lesion, and then that's sent off. If you test positive for orthopox virus, they'll send your sample to the CDC to confirm that it's actually monkeypox. But if you get a positive, just the orthopox is positive, that's enough for public health to say, hey, we're going to have to isolate. We're going to have to start contacting people that you've been in contact. We're going to offer post-exposure vaccines to contacts, anything to prevent the spread. And then treatment. There's no treatment specific for monkeypox. Because it and smallpox are closely related, they can use drugs and vaccines that were developed to treat smallpox. Treatment will depend on how sick someone gets or whether they are likely to get severely ill. Most people don't require treatment. But if you're immunocompromised, like HIV, or you have cancer, you're on chemo, you may require treatment because the monkeypox is more likely going to make you sicker. Antiviral drugs used to treat smallpox and monkeypox require a prescription from a physician, and then the U.S. National Strategic Stockpile will have to, based on a request, give the doses of the medication. And right now the FDA is allowing the use of TPOXX to treat monkeypox during this outbreak. Now Joe's going to take over.
After hearing that part of the presentation, most people tend to have a question regarding vaccines. As many have heard, there are vaccines available. A couple different vaccines. We're going to go through some of the specifics. On June 28th, the federal government announced a strategy to vaccinate and protect people at risk from monkeypox. Also prioritize the vaccines for the highest number of cases, provide guidance to state, local, tribal, and territorial health officials. So basically, there is an allotment given out per the cases given. So as you can see by the slides you've seen previously, Kentucky only having 31 cases, we are not allotted as much vaccine as, say, California, is a much larger case count. Then also distributed within that state, Calloway having 0 cases will not garner the same amount of vaccine as, say, Jefferson County, Louisville, who would have larger case counts. So that's kind of how that vaccine is handed out or used at this time. Many of the contacts being reported as anonymous. As a result, the CDC has been revising their strategy and expanding vaccine usage. In the beginning, it started off as a post-exposure prophylaxis, or only those that were exposed were able to get vaccinated. Now they are moving into a what they are considering a post-exposure prophylaxis plus, which is an expanded area, and we will get to that information here in just a bit. Currently, the 2 vaccines available are the Jynneos vaccine as well as the ACAM 2000. The Jynneos vaccine is the one that most people have heard about and seen in the news and on social media. It is a 2-dose vaccine, originally approved for those 18 and older. It's given 28 days apart. However, due to this recent outbreak, and it has been revisited, there's been an emergency use authorization that has allowed it to be used for those that are younger than 18 as well. You may or may not have looked and read, originally this vaccine was given subcutaneously, and with that emergency use authorization is also allowed it to be given intradermally as well. The other vaccine, the ACAM 2000, is closer kin to the smallpox vaccine that most people are used to seeing that caused the lesion on people's arms as well as a scar afterwards. That was due to the live virus. So that vaccine in the state of Kentucky currently is not being used. Who can get vaccinated? Right now, as far as in the state of Kentucky goes, anyone who reports the following: close contact to someone with known or suspected monkeypox virus, direct skin-to-skin contact or other close contact, a diagnosis of HIV, diagnosis of chlamydia, gonorrhea, or early syphilis within the prior 12 months. Those receiving medications to prevent HIV infection, otherwise known as PrEP medications, exchanging sex for money or non-monetary items, or attending an event venue where there was a high risk of exposure to an individual with monkeypox virus through skin-to-skin or sexual contact. Also continued gay, bisexual, other men who have sex with men, or transgender people who are sexually active, laboratory workers who routinely perform monkeypox or orthopox testing, those healthcare professionals who've had a high-risk occupational exposure without using recommended PPE in the last 14 days, and then individuals on a case-by-case basis who are determined at high risk for contracting monkeypox. Prevention, of course, avoid contact with people with monkeypox infection and any items they have been in contact with. CDC has posted some additional information on their site. Those 2 links are here and will be in the slides, I believe, that will be forwarded and sent out to Murray State as well, and they can get those out. But this information is on the CDC website. Healthcare provider use recommended isolation precautions when caring for patients that are suspected or confirmed monkeypox. That's going to include your eye protections, generally a face shield, gown, gloves, and an N95 mask as well. Congregate settings. Congregate living settings can include dormitories at institutes of higher education, such as here at Murray State. If a monkeypox case has been identified, consider the following: staff or volunteers who have monkeypox should isolate at home until they are recovered. And please keep in mind, fully recovered does mean it can be a 4-week process until the rash is completely healed, scabs gone, and new skin has grown back. Flexible, non-punitive sick leave policies for staff members are critical to prevent the spread of monkeypox. Institutions should also be prepared to offer alternative means of education during isolation period for students. Resident isolation spaces should have a door that can be closed and a dedicated bathroom that other residents do not use. And multiple residents who test positive for monkeypox can stay in the same room. If residents with monkeypox need to leave the isolation area, they should wear a well-fitted disposable mask that covers their mouth and nose, and also cover any skin lesions with either long pants, long sleeves, a sheet, or a gown. And facilities should work with the local health department and identify and monitor the health of any staff, volunteers, or residents who might have had close contacts. And then, of course, one of the basic ones, ensure access to hand washing. And if you do not have that available, you can use a high alcohol content hand sanitizer as well. PPE, staff who enter isolation areas should wear gown, gloves, eye protection, and an IOSH-approved particulate respiratory respirator equipped with N95 or higher. When handling dirty laundry from people with known or suspected monkeypox infection, staff, volunteers, or residents should wear a gown, gloves, eye protection, well-fitting mask or respirator, and PPE is not necessary after the wash cycle is completed, only when handling those that are soiled. Staff, volunteers, or residents should wear gown, gloves, eye protection, and a mask or respirator when cleaning areas where people with monkeypox have spent time as well.
Thank you. We're going to go over some general questions that some individuals have concerning monkeypox, and so we'll open it up for other questions, but these are some general ones that come out. Is monkeypox an STI? And is it no? Monkeypox can be spread to anyone that comes in direct contact of rash or bodily fluids of someone who is infected. Is monkeypox fatal? Monkeypox is rarely fatal. The West African type of monkeypox has a lower fatality rate than the Congo Basin type. The current outbreak is due to the West African type of monkeypox. Should I be concerned about going into crowded events? Because monkeypox is spread through prolonged close contact or skin-to-skin contact, consider the type of event you are planning to attend and consider how much skin-to-skin contact or close personal contact there might be. And this is a crazy question, but it is absolutely something that is true. Is if I get monkeypox, can I give it to my pet? Monkeypox can be spread from animal to human, but CDC rates the risk to animals as low. If you are infected with monkeypox, limit the amount of exposure to them and monitor them for 21 days from their last exposure to the lesion. Can a person who does not identify as men having sex with men can they get monkeypox? Yes, anyone can be infected with monkeypox. While many cases in the outbreak have been seen in the MSM community, transmission has also been seen in heterosexual males, females who have had prolonged exposure to an individual or had contact with bodily fluids, rash of an individual infected. Monkeypox does not discriminate on sexual identity or gender. So there's no specific here. It's just right now, this is one of the areas that we're seeing statistically where the monkeypox virus is the most at this time. So just wanted to ask if anybody that's here has any questions about what we've gone over or monkeypox in general. If it's something medically related, I will put it right back over to our nurses, but do you have any questions about it? Okay. Honestly, right now we don't have it. We don't have a case in Calloway. One of the things that we want to make sure of is now that we have, you have more people in environments that are closer together. So if one person had monkeypox, there's a better chance for it to spread. And so that was one of the reasons we reached out to Murray State, is because we've got people coming from all over, right? I mean, they come from all over the world, or at least in the country. And because of that, there's a better chance for it to be spread. But as of right now, we have 0 cases in Calloway. And you can see we had 31 cases in the state, and the closest to us right now was in McCracken. So right now, it shouldn't be something that, just like a huge concern, but it's something that we need to be careful with and watch, because you never know. All it takes is just one person to bring it in, and then we could have a situation where multiple do. Closest place right now, I'm going to let Joe answer that.
Currently, we have the ability to request a vaccine at the local health department. Later in this presentation, there's actually going to be a way that we can gauge interest to see about the possibility of setting up a clinic, maybe here at Murray State, or a larger clinic than just at the health department. But we can get that and get larger quantities of vaccine, or make those requests in and see what we can get. Once again, going back to the vaccines handed out according to the number of cases you have, and then within the state the way it is, so we can put the request in and see if we can get that vaccine. So that is also something that's going to be piggybacked onto this presentation, is to gauge interest and see if anyone does have interest in that, and then see what we can do from there. We can request the vaccine to the health department. We would have to get that vaccine in. We did have a small quantity of vaccine already, and we have given that out already, but currently we would have to request more vaccine, and once we see what the interest level is, then our level of request will be according to that. If it is close, usually we can get it in a few days, depending on that. They have distributed in, I believe, about 10 different sites across the state, so it's not like it would have to come from Frankfort or Louisville. There are several other satellite sites across the state to where that can be gotten from there. It depends on if they are setting up clinics or how they are offering it. It's up to each individual health department how they go about offering the shots or vaccine. And of course, as always, going back to it, right now in the state of Kentucky, you do have to fall into one of the groups that was listed on the slide earlier to be able to receive that vaccine. Any other questions? As far as testing, once again, they are there are 5 major labs that are set up for testing. So if that provider is set up with those labs, they would theoretically be able to obtain that swab, send that off, and get that testing taken care of. If not, they can give us a call. We can walk them through that, or go from there if they don't have connections for that testing. Well, what they would do is they would then call us to let us know. Then there's a full contact tracing investigation that would take place in order to make sure everyone involved was able to be vaccinated post-exposure. Yes, ma'am. Depends on which lab you go with. Currently, if it's tested at the state lab, 3 days. 2 to 3 days. Yeah, 2 to 3 days, depending on what time the specimen arrives at the lab. Other questions? I'm going to turn it back over to Jamie.
Like we said, we've tried to make sure that we're making this available. And one of the things, when you have a limited amount of vaccine, which we kind of already know, right, with limited amount of vaccine, what that can mean for us. We can go back on COVID when it first came out. One of the things if you remember, they had the 65 plus when it first came out, and they were the only people that they were giving the vaccine to because that was the demographic that was going to do the best with, and they needed it. So at this point, this is kind of how we're handling with monkeypox. Because it's a limited amount, we need to make sure that we use it properly. We don't waste any vaccine, and so that's how we're handling it here at the Calloway County Health Department, is to make sure that we request what is needed for this community and make sure that there's plenty for the other areas. So that's kind of one of our main things here, is to gauge interest, and then within that we can request what is needed for this area. Okay, I'm going to try to go over to this other thing. Let's see how this works. We're going to run a, you said what's called Mentor meter. Right there. Okay. This is Mentor meter. And so one of the things we were wanting to do is gauge interest in the vaccine itself. And so one of the things we want to make sure, though, as we go over again, when someone is going on here to fill out whether they're interested in it or not, or to even ask any questions, we wanted to make sure that this was reiterated. Okay. If you're streaming, there's a code at the top for the Mentimeter, and it is 342858.7. Once again, that's 342858.7, and you can go through that as well. Thank you for reminding me. So one of the things we want to make sure that we reiterate for those that are interested in this vaccine, the areas that we are looking at right now, for those who would require, who could receive the vaccine, and if someone that has close contact with someone known or suspected with monkeypox virus, a direct skin-to-skin contact or other close contact, diagnosis of HIV, diagnosis of chlamydia, gonorrhea, or early syphilis within prior 12 months, receiving medications to prevent HIV infection, exchanging sex for money or non-monetary items, attending an event or venue where there is a high risk of exposure to an individual with monkeypox virus through skin-to-skin contact. And they continued on, gay, bisexual, or other men having sex with men, or transgender people who are sexually active. Laboratory workers who routinely perform monkeypox or orthopox testing. Healthcare professionals who have a high risk of occupation exposure without using recommended PPE within 14 days. Individuals on a case-by-case basis are determined at a high risk for contracting monkeypox. And so I guess the next one's probably going to be the one that shows those who are interested. Are you interested in getting vaccinated through monkeypox? And you'll see the number once again is 34, 28, 58, and 7. Does anybody have any questions? I guess while we wait for this to go. And I believe this questionnaire here is it has privacy behind it, so it is something you can put on here. How long do you usually let these go? Okay. I just want to stand here and stare, and I can entertain for a little while. But I'm not going to sing a song. I've told people I don't mind speaking in front of people, but you ask me to sing, it's a terrible idea. And that's when I leave. But we do really appreciate that. And like I said, the reason we're having this is to try to gauge interest. I want to make sure that we do the best we can with what we have to reach the demographic of people that's going to be the best to meet this need. Yes. No, this is our first major survey, and it kind of was spurred on by the vaccine availability when it came out. Vaccine availability came out, and then kind of our first opportunity was going to be at a place where it really wasn't going to be the best for us to request and know what we needed. Because when they ask you what you want and then say, I'm just going to make up a number and say, I want 200, and then it comes in and we only have 10 people that are interested in it, now we're either going to waste the left amount, or we're going to have to find somebody to take it. And so with us, our first initial one that he's talking about, we requested what we thought, well, we can get rid of this, but we didn't want to over-request and then in a situation where we've either got to get rid of it or wasting it, and especially when it's it's hard to get right now. Okay. All right. Well, I want to thank Murray State for allowing us to come out here and present this. And I hope that if anybody has any questions, I think there was an email that went out that has my contact information on there. My name is Jamie Hughes. Feel free to give me a contact if you have other information or need anything else. And then we can do a follow-up from that. But I do appreciate you all allowing us to be a part of this. So.